increasingly, while there's still a lot of work to be done as far as diversifying healthcare professions and health policy and those types of things, we've come a long way, and there are increasing numbers of Black folks in these positions. And I think part of what our responsibility is to be both those translators, to be those trusted actors, and to also bring our community in. And that requires us to stay connected to our community, to help demystify what is often complex, bureaucratic, and sometimes nonsensical systems that are not necessarily best structured to support trust, right? Like there's a lot of transparency issues. There's a lot of things around like things not making sense, like lots of people got frustrated or are frustrated around the pandemic guidance and like the process of updating information and science and all of those things. So I think one role is increasing, in continuing to work on the diversity in these fields, and also making sure that we are leveraging our roles and responsibilities and connecting and being good stewards and translators to our communities. I think the other thing really is that we as Black folks in our communities, we have to challenge ourselves. So there is education, right? We have to be able to assess what is good information and also engage with that information. I like to tell people, I don't care about being right. I care about doing the right thing, right? And that's, to me, that's the basis of science, right? It's about, it doesn't matter what my personal beliefs are in this moment. If information comes that prove something better, if it's going to get us to that goal, then that's the information that we are going to focus on. And so helping our communities understand and lean into that culture, it's a little bit uncomfortable. It's a little bit, we all are wanting to have stability and to feel grounded. And so this back and forth and this sort of wave in which information passes can be just an uncomfortable thing. So I think we all have to kind of lean into grounding ourselves and being comfortable with that process. And I do think we have to continue to give ourselves a chance. And whether that is like actually going to your PCP, you can't build a relationship with your doctor if you don't show up to the doctor's appointments, right? And I think also, like, I'm completely aware that all PCPs are not equivalent. All doctors are not Dr. Jasmine. And so, knowing that there are options, right? That if you encounter a doctor that isn't a good fit, that we all have the right to choose a different doctor. And part of that work should be continuing to show up and saying, like, let me meet someone else. Let me talk to someone else. Let me get some recommendations from my friends and from my family members.
Because it isn't just health literacy that needs to be increased in order to positively affect these health outcomes and the health disparities. We must really continue to increase media literacy, including social media, political literacy, financial literacy. And I know we're talking about money, but that is a big thing that impacts health, and health literacy, right? Because we know that none of these segments exist as sector silos, but that each of those elements and components are really interconnected and really impact folks' behaviors and daily living of members in our community. It's really important that we really teach our community members to advocate for themselves. And I realize that we often hear this phrase, and it may not look the same for others, because this whole idea of self-advocacy looks different for different organizations in different situations. For example, it's tough to really ask those questions, and some people think of it as exposing their ignorance to some professionals or authority figures, but it's really more important that you hear or get access to the information that you need. Be a journalist for yourself, be a catalyst for yourself. Don't just rely on Google. Ask your healthcare provider, ask Dr. Zapata. She is always making herself available. It's okay to ask who, what, when, where, why, and how, right? Who is the expert? Who has my best interest at heart? How did this come to be? How did you reach this conclusion about the vaccine or my diagnosis, or which vaccine I should get? When should this happen? What's the side effects? All of that good stuff. Why did you prescribe me this medication or this treatment plan or this care plan? What is the expected outcome, right? So those are legit questions that you should ask your healthcare provider. No question is a dumb one. And I think that we also, lastly, have to remember not to just wait on the medical establishment to self-repair us or to save us. I know that there are many working hard individuals that are really trying to reduce the health disparities that exist and address those systematic biases that can impact care. But in the immediate, we all must teach one another how to advocate for ourselves and for our families, because if we don't, who will?
I don't even have to say anything after that. Those were some amazing, I agree with everything Dr. Robinson and Dr. Hanson said. One thing I would say from a clinical standpoint is just emphasizing again the power of trust building and relationship building. In order to have trust, in order to trust someone, it's more than just having credentials. So a lot of times people will say like, oh, we are, we work for this big name public health agency, or I have a white coat, I am a doctor, so people should trust me. Or we are highly educated, we have this degree and that degree and that degree. Guess what? That is not enough to get people to trust you. People need to know that you are credentialed or need to know that you're knowledgeable. But in addition to that, they need to know that you're someone who's reliable. You've been there, you're currently there for them, and you're going to be there for them in the future. And then finally, for people to trust you, they need to know that you are safe. They need to know that they are safe, in physically safe, but also safe in the conversation. So just because you have a degree, just because you have a white coat, just because you work for a high name agency, it doesn't matter. You need to show up. We've been showing up in communities, and we're so interested now in ways to support the Black community, ways to eliminate inequities and focus on COVID outreach and building trust. But where were we years ago? Were we still in the same way that we're showing up with all this money and supplies and enthusiasm to partner with these community-based organizations now that we're in a pandemic? Were we showing up when they were having fundraisers and barbecues and things before this happened? When the pandemic dies down, are we still going to be there? Oh, again, you might need to make me mute my mic because I'm just going, but it's more than just the credentials. We have to show up. We need to show up, and even after COVID dies down, we need to continue to show up for not just the things that are in our benefit. So for example, as a researcher, I partner with communities, and I want to show up when I get a grant or when I'm doing a research project. But when that grant is done, am I going to still show up when they invite community members to the church service to honor us? Or am I going to show up to the picnics and celebrations? You need to still show up and be there. So that is a huge part of trust. It's not just your credentials, it's being there. And then also it's making sure that people feel safe with you emotionally and physically as well. So when you're having these conversations, are you making people feel stigmatized? Are you making them feel stupid or bad for not getting the vaccine or going to the doctor? Or are you making it a welcoming and a safe space to have that conversation? Also, one more thing, touching on the healthcare system, people want to feel safe physically. And when we know that there's implicit bias within the healthcare system, and there's that actually leads to disproportionate deaths among certain backgrounds, we need to fix that. We need to fix that bigger issue so people feel safe even coming into those settings. So overall, those are some of the things that are really important as we some would say rebuild trust, some people will say build trust in the first place. And then finally, it's just important to partner with trusted messengers. So who are the people that community already trusts? Whatever it takes, partner up with trusted messengers to rebuild this trust. We're all in it together.